Hello and welcome to another edition of Health Matters. I am your coach today, Dr. Michael Chillemi. Welcome. So in today's episode, what we're going to talk about is understanding spondylolisthesis. We're going to break down the symptoms, the causes, the diagnosis, and the treatment. It's going to give you a whole new understanding of what spondylolisthesis is, how do you get it, and really understand the granular layers of it. So we're going to basically be taking a deep dive into this condition. And one of the things about this condition is that makes it trickier than most, and we're going to get into this, is the way it presents from patient side, right? So it can mimic a lot of other conditions. And unless you understand what the symptoms are and how do you diagnose it, you won't really understand it. So when I say, what is spondylolisthesis? I know it's a very big word, and most people have a very hard time when they see it. What do you say? How do you say that? It's spondylolisthesis, and it's a condition characterized by the forward or backward displacement of a vertebrae over the one beneath it, leading to spine instability. And it can vary in a degree of discomfort. The condition mostly affects the lumbar spine, but it can affect other areas such as the cervical or thoracic spine. Most times it is in the lower back. The symptoms can range from mild discomfort to severe pain and neurological deficits, depending on the degree of slippage and the impact on the surrounding neural tissue. To understand spondylolisthesis in depth, it is essential to explore its symptoms, causes, diagnosis, various stages, and treatment options. And that's exactly what we're going to do today. So when we talk about spondylo, it's going to go either in one of two directions. The first way it can go is anterolisthesis. So anterolisthesis is, the definition is, it occurs when the upper vertebrae slips forward anteriorly relative to the bone below it. So basically, it slips forward, right? So it comes at you. And a lot of times, this is a common cause of degeneration from aging or arthritis. It could be from trauma, it could be some congenital anomalies. That could be a PARS defect, and I'll go into that in a little more detail in a minute. The other way it can slip is it can slip backwards. So if it slips backwards, that's called a retrolisthesis or a posterior spondylolisthesis. So that occurs when the upper vertebrae slips backwards relatively to the vertebrae below it. So how do you get that one? It's a little bit different than the antero, similar but different. It could be from degenerative changes such as a disc collapse leading to the ligaments or joints instability. And it could also be from weakness in spinal muscles supporting the spine. So typically, you're going to either have an anterolisthesis or a retrolisthesis, right? So when we say that, though, there are 6 different types of spondylolisthesis. They're characterized in 6 different ways. So the ways that they're going to be characterized, the first one that I'm going to talk about is congenital or dysplastic spondylolisthesis. So it's congenital in nature. It's usually present at birth and can be caused by pretty much developmental abnormalities of the spine, such as abnormal bone formation. These anomalies can lead to the slippage of the vertebrae over the one below it, typically due to the malformations. Another one that we're going to talk about, the next one, is ischemic spondylolisthesis. This occurs when there's a defect or fracture in a part of the vertebrae called the pars interarticularis. This condition can result from repetitive stresses of the spine and is more common in athletes. So it's an area of the spine where it's kind of angled down and it could crack right in there. Another type of spondylolisthesis is degenerative. So you have degenerative spondylolisthesis, and that's linked to age-related conditions, right? Like, so your seniors, usually it takes time to develop. So it's a deterioration of the vertebral joints and intervertebral discs, leading to those bones that slip forward. You can also have traumatic spondylolisthesis, just like the name. It's trauma that causes it. So it's a direct injury or trauma to the spine, causing the displacement of the vertebrae. You could also have pathologic spondylolisthesis. So pathologic spondylolisthesis occurs when you have a disease process, such as a tumor or infection. And those typically weaken the bones and cause the bones to slip either anterior or posterior. You could also have post-surgical spondylolisthesis. So this happens due to complications after spinal surgery. It typically is because of some of the structure has weakened so much that the bone has slipped. Okay, next, let's get into symptoms of spondylolisthesis. So understanding the symptoms is crucial for early diagnosis and treatment. Let's delve into specific manifestations. So low back pain. The pain is typically localized and can range from mild to severe, often worsening with physical activity. Pain occurs due to stress on the slip vertebrae and the surrounding muscles. You could also have leg pain and sciatica. So pain that may radiate into the buttocks, down the legs. This happens when the bone slips and compresses the nerve root, right? So, and if it compresses the nerve root, that can lead to sciatica type symptoms characterized by sharp shooting pain. Muscle tightness and spasms. So the muscles surrounding the affected vertebrae may become tight and spasmic, and they may strain to stabilize the spine. That can lead to decreased mobility and further discomfort. You could also, other symptoms you could have is numbness and tingling. Patients may experience numbness and tingling sensations in the legs or arms. If it's in the neck, it's going to go into the arms. If it's in the lower back, it's going to go into the leg, and it'll be associated with the nerve that it is compressed. Weakness. So another symptom you can get is muscle weakness, especially in the legs or feet or hands. And this occurs if the vertebrae slipped, compresses the nerve root, making the movement difficult. You can have postural changes. So spondylolisthesis can lead to a noticeable curvature in the spine or changes in posture as the body compensates for the vertebral misalignment. Okay, so big question is, how do you get it? What are the causes? So understanding the causes helps determine the risk factors for preventing the measures. Congenital defects. So some individuals are born with a vertebral defect that may make the spine unstable. The congenital issue can lead to early onset spondylolisthesis. Spinal injuries such as trauma from an accident, slip or falls, or a fracture or a dislocation can lead to spondylolisthesis, especially in sports injuries. So you're going to see some of these, a lot of these causes now are directly related to the type of spondylolisthesis you have. There's a direct correlation, right? So that makes sense, right? So if you have trauma, it's a traumatic spondylolisthesis. So the next thing I'm going to tell you is degenerative changes. So detail of age-related changes due to wear and tear of the spine causes the bones to weaken and slip, like osteoarthritis. Physical activity. So sometimes you could have activities that involve repetitive stresses on the spine, such as gymnastics or weightlifting. That could contribute to the development of that type of condition. repetitive activities that affect the spine take time though. So it's not something that happens 1, 2, 3. A lot of times it's over time, right? So you've done gymnastics or you've done weightlifting for years and years and years, and you've done the same motion, and it's just over and over and over again. So it's the wear and tear with that type of motion. So there are some genetic factors that can play a role in your development, and that's part of that, the congenital part. So now I want to talk about the next thing I'm going to talk about is stages, right? So it's not only if you have a spondylolisthesis, it's okay, you have a spondylolisthesis and it's grade X. Is it grade 1? Is it grade 2? Is it grade 3? Is it grade 4? You have to understand what the grade is so you know how to get treated. If you don't know how far it's gone, you won't know the treatment. So it is critical that you know how far you have slipped. Okay, so grade 1 spondylolisthesis is a slippage of 0 to 25 degrees. So that means the bone has shifted up to 25%, either anterior or posterior to the bone below. A lot of times those are mild conditions and you have mild back pain. Typically, I'm gonna get into the diagnosis a little bit deeper, but typically we're gonna diagnose this with X-ray. Okay, grade 2 is a slippage of 26 to 50%. And then with that, so again, that means that bone has slipped 26 to 50% from the bone below it, and you are going to typically have more back pain, right? That makes sense. It's twice as much as the first one. You're going to have moderate back pain with potential nerve-like symptoms like radiculopathy. You get pain down the leg or pain down the arm. Typically, we're going to be looking at X-rays as well, and if there's any nerve involvement, then we'll want to look at an MRI. Next grade is grade 3. So as you guessed it, slippage of 51 to 75%. So with grade 3, you start to get to a new level now. Grade 3 is severe pain with significant movement limitations. And usually you're going to have nerve-related symptoms, including numbness and tingling. We're going to definitely diagnose this with X-ray, and this nerve symptoms, we're going to want to look at the MRI as well. Typically, these are potential surgical candidates, grade 3. Grade 4, as you can guess, 76 to 100% of slippage. Severe functional impairment, nerve symptoms, difficulty walking. This patient is in severe pain. This bone has shifted completely in front of the other bone. Let's see if I can do it. So it's basically shifting completely above the other bone. And it is completely either anterior or posterior, right? So it's going to slip significant. And when you slip that much, your area is unstable. When it becomes unstable, you're going to have a lot of pain. Your body's going to try to lock you up and freeze you up, not let you move. That's why you can't move, because your body in its infinite wisdom will protect you if it can, to not hurt yourself anymore. That's why your body locks up. That's why your body freezes, because your body is saying, hey, wait, stop. Do not go any further because you will hurt me, and your body doesn't like to hurt itself. It tries not to anyway. Okay. Again, for this, we're going to diagnose this through X-rays and MRIs and whatnot. Typically, grade 4 is usually a surgical intervention. A lot of times it's spinal fusion. And the last grade is grade 5. That's 100%. It's called spondylolisthesis. That's complete slippage of the bone. And you have major, major disability, severe pain and severe nerve dysfunction, X-rays and MRIs, and this is almost 100% surgical time, right? It's almost a surgical case almost every time. It's imperative that those patients, if they're having those type of symptoms with those radiological findings, you really get a good surgeon to evaluate. Okay, so diagnosis of spondylolisthesis. So obviously physical exams first. We always do a great history, great physical exam, evaluate motion, muscles, your orthopedic tests. We're going to check everything, assess your pain, assess your reflexes, checking your nerves. We're going to also check your posture. But for this particular condition, and the reason it's a little bit more difficult than some of the other conditions, because, all right, so if you have back pain and you have radiating leg pain, you could have a lumbar radiculitis. You could have multitude of other conditions that mimic the same, but this one has it as well. So really, the key factor for this one is imaging. X-rays are going to be one of your best friends for this type of condition because it's going to show you how far the bone has moved. The only time you're going to use MRI and CT scan is when you're looking at nerves, if you think the nerves are affected, right? But X-rays will show the degree of slippage, and it is up to your doctor to tell you how far you have slipped, or the radiologist to tell the doctor to determine how far you actually have gone. But typically, we're going to do the MRIs to visualize the soft tissue and nerves and any other compression that is there. X-ray will show you bone, MRI will show you soft tissue. So that's why when you get an X-ray, a doctor cannot tell you, hey, Mr. Patient, you have a herniated disc, or you have a bulging disc, or you have a spondylolisthesis. You can't, well, the X-ray you can show spondylolisthesis, but you can't tell a herniated disc or a bulging disc. You could approximate space, but MRI will tell you that. That's the importance of MRI. You could also get a CT scan, and that's going to give you more precise bone details for assessing fracture. So if you suspect a fracture or a defect like that, then you're going to want the Cadillac of that, which is the CT scan, to really see the damage. Other tests that can be done, bone scans to detect changes or stress factors, so small factors that you don't typically see on X-rays or CT scans, that a bone scan will pick it up. Other testing that can be done, you can do EMGs and NCVs. That'll determine if your nerves are being affected and if they're being affected where, right? So that's also part of doing the nerve evaluation. Okay, so in my office, we have a lot of patients that have this condition, and most times we're able to treat the patient with no problem. Right, so obviously everything is key and relative to how far did the bone slip, how much are your symptoms affecting you, and that's kind of the key component of this. Is, are you in stage 1? Are you in stage 2? Stage 3? I'm not so keen on wanting to treat that. Typically in stage 1 or 2, we're looking to treat it, and we'll treat it conservatively. So whether we start with physical therapy. And physical therapy, we're going to manage spondylo by doing some targeted exercises that strengthen the core, particularly your abs, your abdominals, and your lower back muscles. You're going to need to stabilize your core, right? When you stabilize your core, your whole body is going to move better in your lower spine. So stretching and strengthening with posture correction is what you're going to look to want to do and improve mobility. So chiropractic care, we're going to definitely be a non-surgical option, especially for stages 1 and 2. We're going to use our adjustments to improve the alignment, which is going to help take away pain and discomfort. We're also going to be utilizing different modalities to help treat the tissue around it, right? So the whole point of moving the bones is you have to work on the soft tissue, because if you have tight soft tissue and you treat just the spine, you don't do any prep work. When I say prep work, that means anything from electric stimulation to ultrasound to different treatment modalities. We have too many to list. But if you don't prep the tissue around it, then what happens is your muscles have memory, and that memory is going to cause the area around it. So even though if we move the bones and take some of the pressure off, it's going to bring it right back, and it brings it right back because of the muscle spasms in the area and the muscle tightness. You have to relieve the muscles. And then once you do that, then you can move the bone. Then the bone has a chance of staying where it needs to be. and the pressure comes off. And the tighter the muscles around the faster it's going to pull back. Okay, other treatments, non-surgical treatments that we're going to look at is pain management. So whether they give you over-the-counter medications like NSAIDs, like ibuprofen, naproxen to help decrease pain and inflammation. They could do epidural injections for severe cases of pain, steroid injections even. That'll temporarily reduce the inflammation to the nerve and the irritation. Bracing. Spinal braces are sometimes recommended to limit motion in the area as well as provide some stability to the area. And especially if you want to try to get out of pain, this is one of the ways that you could do that. Lifestyle modification. So changing your daily habits can significantly impact what you're doing. Avoiding prolonged bending, twisting, heavy lifting, maintaining good posture to reduce spinal strains. You're going to want to engage in low impact activities like swimming or walking to keep the spine mobility without overloading it, right? Weight management can be beneficial in reducing some stress on it, but just be very careful and be very limited to what you put your spine through as far as stresses. Alternate therapies, you could do acupuncture, you could do massage therapy, you could do yoga for stretching. Regular monitoring for mild to moderate cases of spondylo are critical for patients to make sure it hasn't gone any further, right? So if you're noticing it, if you have a traumatic or a gymnastics type injury, you want to make sure it stays stable, right? So one of the things we talk about is it a stable spondylolisthesis, meaning the bone isn't going to move anymore. Your body has adapted to it and it's locked in place and it's not going to go any further. The only thing with that is, all right, so here's a question. I'm going to give you a question. Here's a question. If you have a grade 1 or grade 2 spondylolisthesis and it's stable, then you get into a car accident or you have a trauma, can it get worse? Simple answer is yes, definitely. So you can definitely take a grade 1 or grade 2 and make it a grade 3 or grade 4, or hopefully never a grade 5. Right? So that can definitely happen. So you definitely got to protect yourself, right? So that's why core stabilization is important. So basically, the non-surgical treatments aim to improve the quality of life, manage symptoms, and stabilize the spine. While many patients experience significant relief, it's important to manage it. There are times where you're going to need surgery, right? Grade 3 is up in the air. It depends on what it is, if you're going to get surgery or not. Grade 4 or 5 are almost always a surgical case. And that's something that you should really pay attention to. When we're talking about surgical treatments, one of the treatments that they talk about is decompression surgery. So the purpose is to relieve the pressure on the spinal nerves by removing parts of the vertebrae that cause disc pressure. That could be maybe removing a bone spur or herniated disc material. That can help alleviate some of the leg pain and restore function. Other conditions that exist, laminectomy, spinal fusion. So spinal fusion is going to be basically to stabilize the spine permanently by joining 2 or more of the vertebrae. So it's going to combine the slip vertebrae into a solid bone to restore stability. A lot of times they're going to use hardware, so rods, screws, cages, to really stabilize the spine. That's going to try to improve both the mechanical stability and correct the deformities in the higher grade spondylos. Typically, they're going to do bone grafts, so they're going to take a piece of part of the bone from you, and whether it's from your hip and whatnot, and then put it into the area to stabilize that spine. So again, different types of surgeries, laminectomy, and that's when they basically take out a piece of bone and fuse it, right? Other conditions that they could do is microdiscectomy, remove part of the disc. You also could do what's called minimally invasive surgery. So sometimes they use minimally invasive surgery to take off some of the pressure, and a small incision is made, and the muscles around the area are affected, and it's not as big of a surgery, obviously, as a spinal fusion. It's meant to be a smaller type of surgery, typically with advanced imaging and robotic tools to have precise surgery. Okay. So the key considerations when the surgery necessary, when your symptoms and your grade dictate, right? So your doctor will tell you what grade you are and if you're a surgical candidate or not. And your symptoms honestly will really gauge where you are. The goal of surgery is always to restore function, to improve the quality of your patient's life. Okay. So in conclusion, on spondylolisthesis, it's a complex condition that varies in severity and impact. By understanding its symptoms, causes, stages of diagnosis, and treatment options, individuals can take a proactive step toward managing their condition, improving their life. Proper diagnosis is critical. Physical exam, you need to see a professional. You need to have imaging. It is vital for determining the degree of slippage and identifying the most suitable treatment. It is crucial, I can't say it enough, the importance of consulting your healthcare professional to get an accurate diagnosis. Back pain or related symptoms should be addressed promptly by your medical provider. So, with all of this said, it is important to understand what your condition is, how to get it treated, and where to get it treated. So spondylolisthesis is something we treat all the time in our office, especially grade 1 and grade 2, a lot of grade 1s. We correlate that with orthopedic and neurology departments to determine what's the best care for patients. And it is critical that you take that appropriate steps. Don't let pain dictate how you affect your life. Get yourself treated. Early detection is best. The earlier you know about something, the best you can take care of it. And as always, I tell you on this, the information I give you is my opinion alone. This is not medical advice. Please seek a medical professional for your own specific condition. So as always, we only got one shot at this. It's important for you to take your health seriously. Spondylolisthesis can be a very treatable condition in the beginning. As you get on and on, those stages that we talked about, you have to take care, right? You don't want to get to those levels. So it's important to take care of yourself. Be smart, be healthy. But at the end of the day, health matters. Till next time, be well, be safe.